In Smile in 3 Days concept, we are using Zirconia bridge, and this Zirconia bridge is actually a hybrid bridge. And what we mean by a hybrid bridge is that the front teeth are translucent, because while this Zirconia bridge is being made in CAD/CAM, and when it is being designed on the computer, we allow 0.8 mm of lesser material in zirconia, so that ceramic can be added as a veneer, and that allows us to give the translucence and allows us to play around with the final shape of the tooth, because every patient has after the trial they may want to have some slight changes. So it gives us that flexibility to play around with the front 6 teeth. And when we are saying hybrid, what we mean is that the front 6 teeth are having a thin ceramic veneer, and the back teeth are having a monoblock nature, in the sense that when you cut a cross section of the zirconia back crowns, it is just one material. There is no ceramic coating anywhere here in the back teeth. So that gives the teeth the ability to resist heavy forces, especially in patients who have bruxism. So there is no chance of any chipping of the teeth. Now, when you compare this bridge with any other technique, I forgot to say one more thing, that this bridge is cemented onto the implants. It is not tightened with screws, because whenever you tighten a zirconia bridge with screws, there is a limitation on the torque. If you apply a torque higher than a certain amount, the zirconia is likely to chip. So for that, in other zirconia bridges, they give metal sleeves or they give a metal frame on which the zirconia is cemented. Now, if you see any other type of materials which are being used, the most commonly used is a porcelain-fused-to-metal bridge, wherein the bridge framework is made of metal, something like this. All of it is metal, and then there is a coating of ceramic on it. Now, again, the problem with ceramic in posterior teeth is that with time, there will be slight wear and tear, and then the thickness of the ceramic wears down and goes beyond a certain threshold level, and then it starts chipping off, exposing the gray metal inside. You see many of such cases. And then the other problem with metal is that in this, they make holes for the screw to be tightened. And in that, what happens, the ceramic around the well of that hole chips very easily, and soon the metal is exposed. And the third type of bridge is the hybrid acrylic bridge, and this bridge has very low wear resistance. So soon the bridge starts wearing out, just like dentures do and plastic does, and they are just a temporary measure. They are just used for a temporary fixing the teeth. So when you compare this kind of bridge with any other bridges, this is definitely the best, because it has both the things: great aesthetics and very robust posterior teeth which will not chip and will not allow the jaws to overclose with time and allow the jaws to give that aging effect. Today, zirconia is the best material available for full mouth dental implant prosthesis because of its various advantages. One of the foremost advantage of zirconia is its aesthetics. And in aesthetics, what we mean is that the shade of the zirconia can be chosen as what the patient wants. It can be an A1, B1, or a bleach shade. And that gives a very big advantage for the clinician to actually help patient get what color they want. Secondly, we can give good translucence in the front teeth by allowing the technician to place a thin layer of ceramic, which gives good translucence, and we can play around with the shape. Now, the second biggest advantage of zirconia is that it is a very biocompatible material. It is so biocompatible that some companies have tried to make zirconia implants because zirconia does not behave like a foreign body in the human body. So the body does not reject it. It actually accepts it. That's why we call it as it is biocompatible. And because of that nature, if the zirconia is touching the gums very closely, then the gum actually adheres to it very well. There is no rejection there. That is the very important aspect which should not be ignored. And that is the reason that you should have only zirconia or titanium here. There should not be any other thing. For example, in other materials, in other techniques, they may have zirconia and a metal sleeve and then the titanium here. So there should not be any other material, just the titanium and the zirconia. And the third advantage of zirconia bridge is its durability. They are known to last more than 10 years easily, and my cases have already, many of them have crossed more than 12 years and they're all fine. And those are hybrid bridges actually. So now let me tell you how we have incorporated zirconia bridges in our practice in this technique called smile in 3 days. Because what happened 15 years back almost, when the zirconia crowns were becoming popular in India. So when we were trying to put zirconia crowns on natural teeth, even the technicians were not so expert in that. So in the beginning, the crowns were chipping, they were breaking very easily. It seemed like these zirconia crowns were very brittle and would succumb to more stress. But soon the technicians improved, and we also started putting zirconia bridges for implants. And in those years, we used to put zirconia bridges which were coated with ceramic even in the posterior teeth. That was because in those years we had zirconia which was only in one color. It was a very bright white. So a patient who did not want such a bright color, we had to coat it with ceramic. So in those years there was no choice. All the bridges on ceramic were zirconia with a coating of ceramic or porcelain, but still those bridges are lasting. They are still intact, they are good, they are doing good. And today's bridges are much superior. They are better in strength, they are easy to handle. And in a decade's time, the technicians have really improved, the materials have improved, the technician has improved, the clinicians have improved, and it's no more two-layered bridges. As I told you, that this is a single layer. It's a mono block. The whole bridge is only one piece. If you cut anywhere, it's just zirconia. Only in the front canine to canine, it's a thin 0.8 millimeter of ceramic. So this is how we have evolved with the zirconia bridges, and we cement the zirconia bridges on the implants. Another big advantage of the zirconia bridge is that the cusp of the posterior teeth are very precise, and they are made with computer assisted designing. And in that what happens is that we get sharp cusp which help in proper chewing, just like how they are in natural teeth. And if you compare this kind of thing with any other technique, they may have a metal bridge with a coating of ceramic, and this ceramic is made by hand by technicians, and depending on the experience of the technician, they may or may not be able to give this kind of form. And even if they do, the ceramic will wear out with time, will chip with time, will become blunt with time, because it will wear off. So, and when this is made with CAD-CAM, the precision is 7 microns. So the posterior teeth are non-chipping and beautifully, very nicely functional for chewing food.